Boston City Council President Kim Janey is ready and waiting to step in as acting mayor when Marty Walsh is confirmed as Secretary of Labor. She'll be the first woman, first person of color to ever hold the job, but hasn't yet said whether she plans to run for a full term in the mayoral election this fall. If she does, she'll have plenty of company. City Councilors Michelle Wu, Andrea Campbell, and Annissa Essaibi George have all announced their campaigns, and this morning, State Representative Jon Santiago officially added his name to the list. The South End Democrat has represented Boston in the State House since 2018 and has been working on the front lines of the coronavirus pandemic in his role as an ER physician at Boston Medical Center. Representative Jon Santiago joins me now. Representative, congratulations on your candidacy.
Thank you so much, Jim. Happy to be here with you.
So 3 city councilors, as I said, in the race so far. What would you bring to the mayor's office that none of them would?
Look, I think this will be the most consequential mayor's race in our city's history. We have a pandemic that has completely upended society as we know it, our healthcare system, our schools, our small businesses. And I'm running for mayor to bring Boston back stronger than ever, to really lead us through this crisis into recovery rooted in equity and opportunity. And I say that because this moment really transcends politics. The city of Boston needs a leader, needs a servant leader. And I think I've dedicated my whole life to pursuing that, be it in the Army, in the Peace Corps, and on the front lines of the COVID-19 pandemic. And so I'm looking forward to taking that message out to the campaign and getting folks in Boston excited about this campaign and on board.
Wu and Campbell, as you know, announced their candidacy even when most assumed that Marty Walsh was running for another term. Would you have run if Walsh was running for re-election, Representative?
Listen, I've always stepped up in times of crisis. During the first surge, I in fact doubled my hours in the emergency department to serve my patients in my community and to give my fellow colleagues at the hospital a break. I doubled down on my commitment to the COVID-19 response on Beacon Hill. And in a similar light, right now, I think the city needs a leader. It needs someone who understands crisis management, someone who's ready to deliver with urgency. And that's what we bring to the table. Listen, I have a great relationship with the current candidates who have announced their intention to be the next mayor of Boston. They're friends of mine. They're colleagues. We've worked together. I have tremendous respect for them. But I bring a whole different set of experiences and perspectives to this. And I'm excited to take this on the road and to get folks involved all across the city.
Well, let me try it another way then. If you won't tell me if would have run against Walsh, do you think Marty Walsh has served the city well?
Listen, I have tremendous respect for Marty Walsh. He's someone I've talked to before I decided to run for office, and I've had several conversations with him since then. I think he's done a formidable job and during the COVID-19 response. But I really think the people of Boston are not interested in relitigating the Marty Walsh 7 years in City Hall. I think they're interested about the future of Boston, where it's going, who's going to get us out of this crisis, and I think we're that candidate.
So I'm sure you saw Shirley Leung's piece in the Globe the other day, the headline of which was, "Is it a foregone conclusion that Boston's next mayor won't be a white male?" Let me reframe the question. Even if you are not running, should the next mayor of Boston be a person of color? As you know, we're one of the few major cities in this country that has only had white men as mayors.
I think it speaks a lot about where we've come as a city, as a state, as a country in terms of politics. Here we are living in a majority minority city, and where folks that weren't necessarily represented in politics for a long time are being represented now. We're at an amazing point in Boston where we're not talking about if a person of color can lead the city, but which one will. And I'm excited to join that stellar cast of candidates and make my case for the next mayor of Boston.
So you were the House Vice Chair of the committee that's beginning oversight hearings of the Baker administration on Thursday. I'm sure you saw the Massing poll this morning, where 71% of people polled in Massachusetts approved of the way the governor was handling the pandemic. Had you been polled, would you have been among the 71%?
Listen, I think we are all living under this pandemic. I don't envy the governor's position in this. He has a very challenging job. I think I would have handled certain elements of the vaccination rollout differently, and that's why I put forth a bill. Well, I put forth a bill early on this pandemic, right when he came out with his web-based approach. That listen, not only do we need a web-based approach that you don't need to be technologically savvy to use, but we need a telephonic response. We need to make sure that it is culturally competent, that is linguistically appropriate, and that equity is the foundation of the vaccination rollout. This is not a game of just how many vaccinations we can get administered as soon as possible and what's the most efficient way. This is about reaching out to those communities who have been hardest hit by the virus. And I know those communities because I serve and I live amongst them. These are my patients. I hear them when I'm working with them in the emergency department. And those are the stories I'm taking with me to Beacon Hill. And on Thursday, when I serve as the vice chair of the committee, I'll be speaking with their voices.
You know, Representative, when I hear you say you had a bill which was a better idea, at least in one area, and I've read virtually every criticism that's come from a Democrat, particularly in the legislature, to which I respond, then why don't you do something about it? I mean, Democrats generally. It seems to me, until this hearing, Democrats on Beacon Hill have been pretty passive and stood back, criticized the governor, but not done much to advance alternatives. Is that not a fair criticism?
No, I would disagree with that assessment, Jim. I think, listen, we've put forth a bill. We've stepped up our pressure and our advocacy within Beacon Hill and outside Beacon Hill. And as a result, I think we've moved the governor in a better direction. There is a call center now. It is operating, in the evenings and on the weekends. There is an effort to reach out to those communities of color right now. And I think you'll see more of that moving forward because we're demanding it, not just those of us on Beacon Hill who are fighting for more equitable access to care, but those of us on the ground, in the hospitals, serving those communities hardest hit by the virus. And so, the next couple of months...
I'm sorry. Go ahead.
No, the next couple months will be rocky, will be bumpy. My particular concern from a public health perspective is the race against these variants. And as you know, we have multiple variants that are here in Massachusetts, many of which are more transmissible. And my concern is that if we don't get folks vaccinated soon enough, the virus will continue to propagate, replicate, mutate, and result in more variants that might have a easier time of escaping some of these vaccines.
Very quickly, before you go, there was a horrifying report released the other day about city contracts with women and contractors of color. As you know, less than 0.5% black contractors, less than 1% Latino contractors, barely 1% Asian American contractors. The mayor responded with an executive order mandating that 10% of city contracts go to firms owned by people of color, 15% women-owned businesses. Did he do enough?
Well, I think we have a lot of room for improvement in that respective area. Listen, the fact is that Boston is a majority minority city. I'm a Latino person. I live in a part of town where a whole bunch of businesses that want to have access to these contracts exist, and they've expressed their frustration to me. We can do more. We will do more under my administration. I'm looking forward to working with people all across the city to really come up with those policy platforms over the coming months. I think today, we're excited about announcing our candidacy, but I'm really excited about the next couple of weeks, couple of months, and engaging neighbors and community leaders all across the city to make sure that we have the ideas that represent their interests and their needs as we move forward. And hopefully we'll be in City Hall in 9 months.
Jon Santiago, good luck in the campaign, and thanks so much for your time. I appreciate it.
Thanks, Jim.